Impaza tablets. The drug increases sexual desire and satisfaction with sexual intercourse. Regular use of the drug contributes to an increase in serum testosterone levels, with a moderately reduced initial level. Indications. Impaza is indicated for use in adults, erectile dysfunction of various origins. Contraindications. Increased individual sensitivity to the components of the drug. Age up to 18 years. Lactase deficiency. Lactose intolerance. Glucose-galactose malabsorption. Dosage and administration. The risk is not intended for dividing the tablet into parts. At one time, one tablet. Keep in the mouth until completely dissolved, not during meals. To improve erection, ability to have sexual intercourse, a treatment and prophylactic course lasting at least 12 weeks is recommended. One tablet 1 to 2 times a day. If necessary, course therapy can be repeated after 3 to 6 months. Special instructions. The composition of the drug includes lactose monohydrate and therefore is not recommended to prescribe it to patients with congenital galactosemia, glucose or galactose malabsorption syndrome, or with congenital lactase deficiency. Side effects. Possible reactions of increased individual sensitivity to the component of the drug.